Arterial pulse. As blood is forced into aorta during systole, it sets up a pressure wave that travels along the artery with expansion of arterial wall, and expansion is palpable as a pulse. The rate at which wave travels is 4 meter per second in aorta, 8 meter per second in small arteries, and 16 meter per second in arterioles. Pulse is felt in the radial artery at the wrist about 0.1 second after the peak systolic ejection into the aorta. Arterial pulse can be measured by sphygmograph, and pulse recording is called as sphygmogram. The normal pulse is called as catacrotic pulse. Arterial pulse tracing shows a sharp ascending limb, that is upstroke, which is called as anacrotic limb, and a slower downstroke, which is called as catacrotic limb, with a diacrotic notch. Diacrotic notch is caused by the vibrations set off when aortic wall closes suddenly at the end of systole. The diagram shows the tracing of the anacrotic limb and the catacrotic limb, which with the diacrotic notch. While examining pulse, the rate, rhythm, volume, character, condition of the vessel wall, radiofemoral delay, and other peripheral pulses and pulse deficits are observed. Arterial pulsation can also be felt in facial artery, common carotid, axillary artery, brachial artery, femoral artery, popliteal artery, posterior tibial artery, and dorsalis pedis. Types of pulses. They can be collapsing or water hammer pulse. This is seen in aortic insufficiency. Here, there is a rapid upstroke and rapid downstroke without diacrotic notch, for example, in aortic regurgitation. Slow rising hypokinetic or small volume pulse. Here, the volume ejected will be less, for example, in aortic stenosis. Pulses alternance is here there will be alternate small and large volume pulse, for example, left ventricular failure. Bispherians pulse is a combination of slow rising and collapsing pulse, for example, in aortic stenosis with aortic regurgitation.